Good afternoon. I hope all of you are having a great weekend and you enjoyed your Halloween parties. Today, I'm going to talk about a subject that is very important in the context of value-based healthcare. These are bundle pricing. Bundle pricing is one of the figures that was introduced into healthcare by the Affordable Care Act in 2012. And there are two types of them. One that is set by the law, by the CMS, which enforces healthcare providers to mandatory introduce bundle payments on certain procedures. And others is voluntary. These providers or any provider can, in certain specialties, introduce bundle payments or develop them on their own if this implies any benefit for them and their patients. Bundle payments concept is very easy. It's when an organization, a healthcare provider, will provide certain procedure or certain service in exchange with a reimbursement that is a single payment, a fixed single payment that will cover everything that has to do with this procedure in the context of regular procedures. If there is obviously any outlier complication, this will not be covered by the bundle payment. However, this concept, as simple as it sounds, could have, as we will see in the next few minutes, very, very important effects in the improvement of healthcare and the achievement of value health, which is one of the topics that I most of the time address in these short videos. The requirements for successful bundle payment include, first of all, knowledge. We have to have the data. We have to know the data. We have to know our cost structure. We have to know our history with this specific procedure. We have to know how much does it cost when there are complications, and if there are some outliers, some cases that are more complex than others, how often do they come? What is the frequency? This is the most important element, knowledge, data. And if we have more data and more accurate data, we will do better with this bundle pricing. The other part that is very important is the risk assessment. Obviously, it implies a risk. When I don't have the opportunity to go back to the payer or the patient for more money, I am assuming a risk. So I have to do a very, very conscious risk assessment and risk management. And this includes, and that is my recommendation in many cases, contracting an excess loss coverage with an underwriter. In case I have specific cases that will come into my medical center and I have to take care of them, and eventually the money is not enough, I have to have someone that will support me to cover these expenses. The other part that is very important, and that it's also a benefit of a bundle pricing, is to engage physicians. If physicians understand how this works, how their participation in developing bundle pricing is important, and how they could benefit, because they could get incentives on this bundle pricing, the program will probably be a success. Not only patient, but physician engagement is critical for the success of bundle payments and to achieve the goals that we want to reach with this kind of pricing. We have to be also very knowledgeable of our cost structure. We need to include in these payments all costs related to the procedure, and not only the costs that affect directly this procedure, but other costs like the administrative cost, overhead, because if we don't cover this at some point, we're going to have a deficit, and that will hit us very hard in our financial statement. If we are successful in developing these bundle payments, we will see many benefits. I'm going to mention some of them. The first one, patient experience, less waiting times. And now that we are having this type of health plans with high deductibles and high copayments, The patient will be benefit if they know exactly how much to expect, that there are not hidden costs. They know the cost is fixed and they will be able to assess how much they will have to pay and limit their exposure to risk. So this is very important, the improvement in patient experience, not only in the financial side, but also in the experience as they come in and access the medical center. Because now they don't have to wait for days and sometimes weeks to get a price. They can get it immediately. Once they know the procedure they want, if the medical center has a bundle developed, they can immediately respond and save time and improve the experience of the patient. It also becomes a competitive advantage. If a medical center can develop this pricing faster, they will probably get more patient volume because they will be providing a better experience and they will be controlling the financial risk for the patients. So it will become a competitive advantage that will generate more volume, and with more patient volume, my quality will improve and my outcomes will improve in the medium and long range. We will have cost reduction, and this is very important because when we have bundle pricing, the payer relationship situation improves and the revenue cycle administrative cost will reduce and in some cases disappear because we don't have to go through the coding and look at every case and go back to the case manager and go back to patient access. We have the procedure, we have the price, it happens this way. And it will also facilitate the collection process from the payers, because if the payers already know what they have, how much they have to pay, it's only issuing an invoice that will be very clear and simple, and the reimbursement will happen faster. So not only our administrative costs will go down, but our cash flow will improve. This will lead us to improve our patient relationships, our payer relationships, And if we have better payer relationships, this will benefit our financial statements because we will be included by employers and payers in preferred networks. We will have more clients, we will have better collections, and everything will go better for the organization. And if the situation of the financial statements improve for the organization, the patients will be benefit at the end of the day. So as we can see, this simple element of bundle pricing can have effects in many areas of healthcare and will be aligned with the AAA framework because it will improve patient experience, improve healthcare, and reduce cost. This is what we know as value. We will reduce waste. We will be generating value and better patient experience. The focus will be in the patient, and we will be getting also better financial results for the organization. These are the type of things that with one or two changes will escalate to other changes, and generate an improvement process that will be beneficial for everyone involved. So let's commit to bundle pricing. Let's commit to the different possibilities that this offers. Let's mitigate our risk through the risk assessment and risk management, and go out there, give our patients bundle pricing, give our payers bundle pricing, improve health, improve value, and be successful as medical providers in the new era of healthcare under the Affordable Care Act. Thank you.